But you think of just our choices in the diagnostic world, we're usually wrong about 40 to 50% of the time. Eeny, meeny, miny, mo. Hello, everybody, and welcome to another Pilates Hour by Polestar. It's great to have everybody here. Today's going to be a little bit different. So as you're signing in, just getting ready to talk about some things that are a little more sensitive, I think, at least sensitive to me, and I hope they're sensitive to you. And we're going to be talking about how we overcome some of the challenges we have as healthcare providers and wellness providers when we ourselves are struggling with health conditions and maybe mental conditions and challenges that we have. And I know this is a real challenge. I hear it all the time. And many of you know I've been going through my own challenges. So I thought the time would be appropriate. Just in my own life over the last bit, we've had quite a few challenges in both emotional, physical, spiritual, family-based things. And looking for the tools to be able to be okay so that I can be the healthcare practitioner that I am, right? And I think that's one of the challenges we have. While you're going into this question on Mentimeter, I do want to just start off by saying I'm really grateful for everybody that has been supporting me through these challenges and to give you a little history of my story. So starting about 10 months ago, I started having some pretty severe leg pain that I was interpreting as hip and knee pain. And the reason why I tell you this story is because I was completely wrong with where the origin of the symptoms were coming from. And being the orthopedic physical therapist, I sort of made a bunch of assumptions and was not accurate with that. So again, working on a lot of things of like, what is my hip doing? What is my knee doing? Even to the point that in December, many of you know, I had my left hip replaced. And the hip replacement went well, but it was not the solution. At the same time, I was dealing with a heart condition, a cardiovascular condition, and I was dealing with some challenges personally in my family, extended family, with my mother being ill and a stepfather being ill. And starting in January, I started traveling again after that hip replacement, and things continued to take a deeper dive. Like my heart condition seemed to get worse, my lower extremity pain got worse, and I just lost hope. I mean, I really did. And I was just struggling to be present wherever I was supposed to be teaching or I was supposed to be communicating. And it was a very, very challenging time for me because I didn't see a solution. I was thinking, what do I have to have? An ankle surgery, a knee surgery, a back surgery, a heart surgery. And then I'm still not dealing with a systemic inflammatory problem, an autoimmune system. And it was just overwhelming to me. And I think this is where I want to talk to people that have felt that in our profession to understand. And I see some things up here coming with people who have dealt with breast cancer, people that have dealt with chronic pain, arthritis, fractured wrist, and all of these things. Like it was embarrassing for me, and I'll talk from my perspective. Everybody has a different way of looking at it. But from my perspective, it was like, here I am preaching to people how to be healthy, teaching them how to be healthy, and I myself was not healthy. I felt very hypocritical. I really struggled with this process of being who, in my mind, I believed I was, and my body was telling me that I wasn't. And so I took a couple months off, and we'll be talking a little bit about this as we go through the process. But I took 2 months off to really focus on getting better. I went to different physicians. I went from my acupuncturist. She's amazing in Chinese medicine. I went to a functional medicine doctor, Dr. Stephen Wheeler. I went to a good friend of mine that was part of my neck surgery 12 years ago, looking at the spine, and of course, my orthopedic team. And then, really importantly, was Angela Crowley, who's a good friend of mine and a master gyrotonic teacher down in Miami. And I sort of was putting all these pieces together, as well as my cardiologist, and then just doing a lot of psychological stuff, like trying to read, trying to pray, trying to meditate to figure things out. And I want you to understand it got so bad for me that I had not slept through the night for about 10 months. Just even the touch of the blanket or the sheet on my foot would wake me up. And then trying to ambulate or to get to the bathroom or to move was excruciating. And yet I was still traveling and doing lots of work that was beyond where I should have been. It was to me in my mind now looking back, it was wrong. So as I went to these different doctors, little by little, and this is the hard part, is that there were so many different answers. Everybody wanted to do different things. Some wanted to do surgery on my knee. Some wanted to do surgery on my back. Some wanted to do some pretty aggressive interventions for the inflammation. And there was a certain point in time where I realized, and you've heard me talk about this, that I had an external locus of control. I was not in control of my life. I really wasn't. I was being sort of driven to and fro by a very heavy schedule, a very high expectation. My mother was dying. We had a couple other deaths in the family, and good news, I was having a grandson that was being born in March, and all of these things, some good, some challenging, some bad, and me having to look like I'm healthy at the POT in Germany for a big Polestar event, et cetera, et cetera. So as I started thinking about this, I realized that I needed to take control of my life. I needed to have an internal locus of control. And that's what we're going to be talking about today as we go through this. And please keep responding. If you've had things like what we're seeing up on the screen right now, this is what I want to come out. I feel almost like we have to articulate it. And the nice thing is this is very nobody can see autonomous. Nobody can see who's writing what in there. So it's just a nice way of getting something up. And I had to admit that I was in a space that was not healthy for me and that it was challenging. And with that being said, I started taking ownership of my own body and listening and looking and hearing what my own body was saying to me. And what turned out was my acupuncturist said, "Oh, all your leg pain is coming from L2, L3, and L3, L4." And I'm thinking, like, yeah, you don't have any imaging. How would you even know that? And I knew I had a stenosis at L5S1. We continued doing some treatments and working with things, and I was starting to feel better. I was starting to do some gyrotonic and gyrokinesis with Angela. And I finally got an MRI of my low back, and it showed that I actually had severe stenosis at L23, L34, L45, L5S1. And the surgeon said, your grounds for surgery right now. And I said, no, I don't want any more surgery, but let's do a test. Let's do a test and do an epidural at one of the higher levels of the back and see what happens. Well, surprisingly, the epidural to the upper part of the low back got rid of 90% of my leg pain that I was having. I still have a little bit of knee disorganization and some discomfort there, but the majority of the pain was gone. At the same time, I was seeing the functional medicine doctor that said, you've got a lot of systemic inflammatory things going on. Let's just start by getting you to cut out gluten, sugar, and dairy. So those were the things that were going on, right? So I had acupuncture, I was got the epidurals in the back, and I was seeing Angela for rehabilitation, especially of my lower extremity and thoracic spine, to try to offset the stress that was happening before in my low back. And discovering that I never really fully rehabilitated either of my hips, that my hips really needed to learn how to balance single leg balance, alternating balance, lateral balance. All of those things were very challenged when I was working with Angela to regroup those. So basically, to a short answer to a long story, so we can move on with today's topic, is that I was able to receive proper medical attention, but it was the way that I was interpreting and looking at it. It was a matter of me making decisions and restoring an internal locus of control to understand what I could do and what things I could not fix. And for me, it turned out to be an epidural, pretty intense bouts with gyrotonic and Pilates, and then working with some nutritional things of cutting out gluten, sugar, and dairy. And the result of that has been that 90% of the pain in my leg is gone. I'm getting stronger and better balance. and I've lost about 30 pounds, which was long overdue. And I'm feeling pretty good with minimal to no inflammatory response in hands, neck, shoulders, and other parts of the body. So, which best defines you when injured as a practitioner? This was something I had mentioned that I definitely fell into. I lost hope. I really did. I lost hope in my ability to get better. I sort of saw with the heart thing and the chronic inflammation. I was thinking that this was the beginning of the end. So would love to see what your thoughts are, where you feel you agree, disagree. What area do you feel the most? Like I said, I was in the middle one, pretty heavy, and I kept sort of faking it until I didn't make it, and then I had to really take time out to get better. And we're sort of in between the fact that we believe in our medicine. That is the highest, thank goodness. We believe in our medicine. And then the next highest one is those of us who go back and forth. And then a small percentage like me that was down in the lost hope category. Now, this is talking a little bit about just when we just our personal behavior, because we'll come back to this as we talk about some of the key points, is where do you spend most of your mental time? Where do we live? Are you always thinking about, oh man, I wish I would have done this differently. If only I did this, or man, things are going to be better in the future when I get this degree. Things are going to be better when I'm married. Things are going to be better when I'm divorced, whatever we're thinking in our head. Or are we actually present? Present meaning that we're right there with our clients. We're right there when we're talking with people. Intimacy and communication is so much better when we're in the present. We're not thinking about other things or what am I going to cook for dinner while you're in the middle of treating a client. Yeah. So I'm glad to see that. So it's nice to see that many of us are in the present. And this is where we want to be. And this is the reason why I bring this up. The reason why I bring it up is because if we are in the present, we're setting a good example for our clients to be able to have that internal locus of control. So I wanted to come back and just think of the first part for ourselves, taking care of ourselves. How do we find our passion again if we have had experienced burnout, if we've had injuries, disease, surgeries, even emotional or mental illness that is on our shoulders, and we want to retake that passion again. We want to be able to be excited about going to work. We want to be excited about our career choice. And so I built out a couple things here and some points, and I hope that it's a good time to maybe take some notes, certainly ask questions, certainly share your experiences, or I would like this to be very collaborative. So the first one is taking time for ourselves. If we have that injury, this certainly is my problem. I don't know how many other people share it, but I took like 3 weeks after my hip was replaced before I was back on the road working. Do we take enough time to really heal or really work through these things? If we've lost a loved one, did we take time to be able to go through the grieving process, or did we sort of pack it into, shoved it down? So like the untethered soul talks about really pushing these emotions, these thoughts down, and they continue to do harm to us. How do we take time like that, right? And in that time off, what do we do? So I wrote down a couple things. Number one, I said, reevaluate your status, right? This was huge for me to look at, things like, where am I in my career path? I'm 61 years old next month. Where am I? And, I've built sort of a small empire in the Pilates industry. I love my physical therapy practice and profession. I'm a man of faith. I love my family, my grandkids. I love traveling. And sort of going back through this reevaluation status of what's most important to me. Now, in business, we call this the shed list. So we look at all the things we're doing and we're saying, what things do I want to continue doing? And what things would I be happier if I didn't have to do those, right? And so taking time to do that, do your shed list. Number two, are you where you want to be in life? Those of you that put present are probably people who are very content with where you are in your journey. It's a very common correlation. I live in the present. I'm content with where I am. We talk about this a lot in Polestar education with the sort of the development from novice to expert. People who are happiest in their profession are content in their pathway. They're happy being a novice and learning something new. Then, as they become more competent, they're happy and content with their ability to be able to have meaningful treatments and interventions with their clients. And then those that are proficient, about 10 years, are content to know that they're efficient in their treatment, that their outcomes are higher, that they're be able to do more things, and that they're able to now mentor and share with others, right? And so it's looking at being content with where we are in that pathway. That is a present person, right? A person that's saying like, man, when I'm a competent practitioner in Pilates, I'm going to be so much happier. When I'm proficient, man, I'm going to be worth my weight in gold. I'm going to be really good. Instead of just saying like, what a great place to be an advanced beginner where I'm trusted by people to teach them Pilates, and I'm surrounded by really good mentors, and I'm learning so much, and I'm able to really help a lot of people, and I know that I'm safe, right? If we can identify where we're at. So are you where you want to be in life? I think that's a big question. Next question is your health in its ideal state? And this is a tough question because a lot of people came into Pilates because of our injuries, because of our disease, because of burnout in our other careers. We came into Pilates and then we fell in love with it and we became a Pilates teacher. And as we became a Pilates teacher, we're looking and saying like, is my health where it needs to be? Now, there's a misconception, and I think the misconception starts with the idea that, um, you know, I should look like the epitome of health. And I want to be very clear that that is not what makes a great teacher. There are a lot of people that look like the epitome of health that are miserable, unhealthy, unhappy. We should be healthy, right? We should feel good. We should wake up in the morning and be excited to go to work. We should be excited to work with clients. We should have the energy to be able to do that. So, is our health in an ideal state? And that health includes physical, emotional, and spiritual health. And then the last one I had in here for taking time for self is, are you finding a work-life balance? So some of you put up there like burnout, and man, we all get burnout in all of our professions. And there's some good cures for burnout. One thing is being able to, go to a conference and you go meet people, and all of a sudden you realize, oh my goodness, you're having the same burnout as me. Can I have your phone number? And you become friends, and now you become support systems, and you realize that learning new information, meeting new people, being able to travel, being able to go different places as part of your profession nurtures you to take a vacation and find that balance. Some of us are fighting that balance between family and work, right? We have to work so much to pay our bills because we have credit card debt, and yet we're sacrificing one of the most important things in my life. My value is family. And I have a feeling, as I've gotten older and had a couple close calls, I don't think, and I believe in God, and I'm a faith man. I don't believe that God's going to ask me when I die how good my Pilates practice was. I think that his or her concern is going to be, was I a good person? Did I love those people? Did I take good care of my family? Was I kind to my neighbors? And so when I think of, do I have that work-life balance? I ask those questions of, is my priority in profession only, or do I have other relationships or parts of my life that I want to develop to find that balance, right? Now, balance is never static. Balance means that it's always teetering. It's always teetering. So there's going to be times where it's heavier, like when I was working on my doctorate. And then there's times where it's going to be lighter, like when I was dealing with some death in the family and just putting a massive amount of energy into my family, right? And doing that priority. So it's always this little give and take. Number two, I put here is a really important one. So this is shifting gears a little bit, but seeking professional help. Sometimes, and I know for myself, and I pull a lot of these things out for myself, I'd love to get your confirmation if these things are resonating with you, or maybe they don't resonate with you and you have some other solutions that could help me. I would be open to that. I'm definitely humbled by this last year in my life, but seeking professional help. Things like regular checkups and screenings. We've had multiple colleagues in the last year that have been diagnosed with some pretty serious disease, from cancer to different neurological impairments like MS. And the question in heart disease, and we just lost somebody to heart disease. Um, and you think that if we had just done our checkups and our screenings on a regular basis, we might have caught that earlier, right? And I know some people also that do have regular checkups and were successful at catching, a certain type of cancer early and being able to negate it through treatment. Number two, with that seeking professional help, is intervention when warranted. Do we get the appropriate intervention? A lot of times, because of all the factors that influence health, and this is going to be something I talk about in depth in the pathokinesiology course that'll be released this fall. When we look at the factors that influence health, everything from the air we breathe, the mold in our house, the food that we eat with processed foods in it, the seed oils, the processed sugar, the list goes on, genetics. I mean, it just goes on and on and on. Exposures that we had at work, certain vector diseases like tick bites and Lyme's disease, and other things that are infections and viruses like COVID and long COVID I saw somebody dealing with, right? All of these can influence how our body is in this process. And so there are times where we have to take the time and invest in getting treatment. Now, here's the disclaimer on this. Our healthcare system in pretty much all the world is really, really challenging to navigate. Just even working with my mother in her last couple months and trying to navigate the healthcare system and navigate it for myself, and being somebody that understands it and knows the healthcare system and still be so frustrated of having different, really specialized doctors see things, everything is a no, because that's what they see when they're a neurologist or when they're a psychologist or when they're, a counselor, and looking at all these different things, right? So part of it is, and this is where I want to emphasize this idea of locus of control. I'll talk about that in just 2 minutes. But if you can think of being responsible, you are the consumer. And I believe that when we are in tune, and what I had to do was I had to really focus on getting present. And that was part of my meditation and my spiritual activities in those first, 15, 20 days, to get to where I could discern between what seemed a little too far out there or wasn't making sense as to everything that I was experiencing. So I was gathering information from, the far left with complementary therapies and medicine, functional medicine, acupuncture, Chinese medicine, to the latest surgeries and neurosurgeons and latest imagery and tests, EMGs, multiple doctors, to be able to formulate a picture of what's going on in my body, and then to be able to pick two things that I was going to test that I felt would have the greatest effect on me and allow me to be able to condition myself and to regain the confidence that I was missing at that time, right? And so this is a very challenging thing. I don't have an answer. I really don't. I mean, it's almost like, my dad used to say, work like it all depends on you and pray like it all depends on God. I think we have to do our due diligence. And unfortunately, it's very costly, timely, inconvenient, and a lot of condescension down to us as the patient that we have to navigate through. And we can't get stuck in it, right? We have to keep pushing our way through it, and to be able to find the practitioners that are going to be the most appropriate for us, whether it's in our mental health, physiological health, or spiritual health, right? And a combination of all of those become very, very important. The last one I had on seeking professional health is nutrition. And I could not believe the difference that I felt in my body. I didn't make any other adjustments in my nutrition other than cutting out gluten, cutting out dairy and getting rid of as much processed sugar as possible. Sometimes you can't see it, but it's in the food somewhere, right? And that meant eating things that were from a raw state into a cooked state that were not processed. And what started happening was my metabolism changed drastically. Weight was being lost. I sort of like the guy, I'm trying to remember his name, Michael. Um, he wrote the book In Defense of Food, and we'll put that in there. But I loved his saying was, eat real food, mainly plants, and eat less. Yes, Michael Pollan, thank you, Rose. And eat less, right? And so to me, it sort of became natural when I cut the gluten products out and a lot of the carbohydrate products out. I didn't have a desire anymore for those carbs, the sugar, and between really clean protein and plants, I realized that my body was happiest, and I could feel my metabolism coming up. Now I'm still working on some detoxing things that I know my body needs to go through, but I am feeling much better. So do take a look at your nutrition. There's a number of good books. I'll put a list of a couple other books that I've been reading that have helped me a lot. One of them put a huge emphasis on things like staying away from seed oils. That does not include avocado or coconut or olive oil, although there are some special guidelines of how to use those. But it is getting rid of all the canolas and mazolas and grapeseed and all of those sunflower seed oils. All of those have to be rancid before they can be processed with chemicals to be able to be used to fry food. And it's the cheaper oil, and it's used in almost all food production. So things like that, and the processed sugar, if you look at uh, it'll come to me in a second, but just getting rid of all of the sugar, Lundquist, I think. Next point I had was rediscover your internal locus of control. So I said I was going to go there on locus of control. And a lot of people, it sort of thinks like people would just know what that means to have an internal locus of control. When our brain and our mind, our internal chatter in our brain is telling us things like your knee won't let you do that, or your boss makes you do that, or those kind of things, that is an external locus of control. So I've had a lot of patients that come in and go, oh, my back doesn't let me ride bikes anymore. Oh, so you asked your back if you could ride a bike, and your back said, Brent, you can't ride that bike anymore, right? And it's interesting. It's something that sounds as simple as that. The reality is that we start losing control when we're blaming things on the economy, on politics, on our boss, our workplace, our age, injuries that we might have, and retaking control of that and bringing it into an internal locus of control. I choose to work here in this place that has a boss that is overwhelming and condescending. I choose to work here, right? That choice might be slim because the other choice means that you're not working, maybe, right? But the idea is that you make the choice because you felt that there aren't other options and that you need to provide for your family, and therefore you are tolerating that behavior to keep that job. But it's a choice we make. It's not the boss doesn't make us work there, right? Other examples of this is when we're looking at situations like the accident or being victimized, right? These are all horrible things that happen to people all the time. Lost a brother-in-law just 2 months ago that was murdered. And, you sit there and you look at that and you think like, it's so unfair. It's so wrong. And as we get stuck in that, we stop having control of things in our lives. We start blaming the police, or we blame society. We blame the fact that we don't have enough homeless shelters, or we, blame ourselves for not doing a better job of taking care of our siblings. And we end up having this external locus of control. So one of the things that I want to really work on is how do we rediscover that internal locus of control? First for ourselves. So those of you that said that you spend time in the present, that perception probably is a good indicator that you are in an internal locus of control state, right? And I can give you incidences of certain events that always put me into a present state. For example, when I'm teaching, like right now, I can tell you I'm not thinking about anything outside of sharing something with you. When I'm with a patient or teaching a course or teaching a class, I am present. I have no idea of time. I have no idea of what's going on out in the world. I only want to be there. I don't have time for superficial conversations. If you've ever met with me, our conversation becomes intimate immediately, or I am bored and I'm out, right? I love being present, right? But there are times when I'm by myself that I catch myself regretting things or looking forward to things, which would mean I'm not present. And we all have a mixture of this, right? How do we find more times that we're present in our life daily than not present? I think that's the challenge. We're not going to ever be all present, right? That's going to be a very Zen guru that is always present. I don't really believe in that. I believe we have to spend more time in the present. Other things that I looked at is how do we take back the control, right? So I have a couple of things, some ideas here. The first one is re-identifying our purpose. If you've done meditations with me, I love always finishing my meditation with Buddha's 3 questions, right? So his first question is, who am I? And very quickly, we sort of filter through all of the roles that we play as our defining role. Like we say, I am a physical therapist, I'm a father, I'm a husband, I'm a son. I am a member of the Church of Jesus Christ of Latter-day Saints. I'm all these things that are identifiers, but they're roles that we play. They don't really identify who we are until we get down into the characteristics and values of who we are. So when we get down to that deeper level of who am I, am I a kind person? Am I a compassionate person? Am I honest? Am I a person of integrity? Am I accountable, right? So as you identify the values that are most important to you, are you that person, right? So who am I? The second question the Buddha asked himself is, what do I need? What do I need? And the need is, what do I need to be the person that I believe I should be? What do I need to be that person? Do I need more humility? Do I need more education? Do I need more time being present? Do I need to be healthier? What do I need? Do I need to serve in the community more? Do I need to help people who are in need of help more? What do I need? And then the third one, which is what brings me in this discussion, is what is my purpose? Now, a lot of us, we have a very unique purpose. We've been drawn to this work because we have compassion, because we have empathy, because we love helping other people help themselves. And that's a driver for us. That's why we chose this. We love feeling better. We love good health. We love to see other people enjoying health. So when we look at what is my purpose, if we can identify that purpose, and it's going to be a little different for everybody. You could think of what's my purpose today in this webinar? What's my purpose this week at work? What's my purpose at home? What's my purpose in life, in the universe, right? And asking those questions help us to clarify that shed list that I was talking about earlier. What are things that I should be doing right now that help me in that direction? And what am I doing that's just wasting my time and burning up all this unnecessary energy and leading to burnout and learning to being sick or depressed or anxiety? How do I shift that gear? A tool that I find very helpful is journaling. Journaling helps us a lot when we are having a lot of self-deprecating thoughts, when we are just not being present, when we're blaming things, loss of internal locus of control. And so I always suggest, and I've read a lot on journaling, I sort of was raised with journaling, but write down successes and failures of your day, both of them, right? Not just successes. Don't write it as if you're writing a novel for your children and posterity to read. Write it as a health tool today. What are things that you succeeded in and you failed in? Now, those of you that teach for Polestar know we do these meaningful feedback loops. And I just got done teaching this at USC in a MAT immersion for physical therapists. And it was very interesting that every time you go through and you do, like there's 5 people in the group, 4 people are giving feedback to the one that just taught. I always ask the person that is now repeating back what they heard, repeat back the positive and the things that could be improved that you heard back to your group. Inevitably, the majority of people go right to the negative things. I heard that I didn't do this well, that we spent too much time, and even the language that they explained it, it's very different than the way their colleague said it. Their colleague might have said, your cueing was so spot on. I really felt it in my spine elongating in that exercise. And I felt that if you would have maybe used a tactile cue, either on like the crown of my head or my sacrum, it would have even been that much better. And then they turn around, their interpretation is my cueing sucked. And that's how they interpreted that feedback, was my cueing sucked. If she did not or he did not give that feedback or what they heard, we would assume that our feedback was a positive feedback to them, but they interpret it as a negative feedback. And that's why in journaling, there's nobody judging. Write down the good things that came out that day, the good teaching, the good conversations, the people that you helped that day, as well as the things that were challenging or failures. And again, in Polestar, failures are learning. We don't talk about failures as something bad. It's not like a grade in school. A failure is an opportunity to learn. And we fail all the time. And in healthcare practice, even the best healthcare practitioners are right 60% of the time. That means they failed 40% of the time. Now, you hope that a heart surgeon doesn't do that, right? But you think of just our choices in the diagnostic world, we're usually wrong about 40 to 50% of the time. Eeny, meeny, miny, mo. Another one is identify one thing that can be improved tomorrow in your journaling skills. So rather than saying, I'm going to do all these things, I'm going to be perfect tomorrow, I'm going to be everything that I want to be, it's just pick one thing and work on that one thing maybe for a month. And then, we talk about procedural learning and we talk about declarative learning. Declarative learning is being conscious about it. So in Pilates, when we're giving them cueing and we're bringing their conscious level up, that's declarative learning. Procedural learning is you practice, 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 practice until it becomes subconscious and automatic. And then we look in our journal and we pick the next thing that we want to work on. And we work on that. And we continue to improve ourselves with no expectations of being perfect, waking up every morning, repeating to yourself, I am worthy of this day. I am worthy of this day. All right. The other thing I put in here underneath journaling is take time to write down negative thoughts about self. When you write them down, you get them out of your head. There's an old saying that I don't remember where I heard this. It might have been in the mind setting course, but if you took your thoughts and you embodied them into another person, would that person be your friend? Would you tolerate the things that they're saying to you? Or would you get as far away from them as possible? Why would you keep those negative thoughts in your head if you could control it at all? Well, I find that if I write them down, I can look at them and I'm articulating it in pen and I'm thinking, that's ridiculous. That's not who I am. That thought doesn't define me. That's not me. So I don't have to deal with that thought anymore. I can replace it with something else. And then the next step is that analyze to see if those thoughts are legitimate. And if not, write down the replacement. If you think that that thought is not legitimate, write down what you think is legitimate. And what you'll start seeing is that you are taking control of those thoughts. Thoughts do not define us. Thoughts are not who we are. They're just thoughts. And as they come in, if those negative thoughts are hurting you or making you feel bad, we start changing those thoughts, identify them, recognize them, spot them, and then move on. Leading us to spotting negative behaviors. So sometimes we just are so oblivious to things around us that we fail to spot the negative behavior or the internal rhetoric of, man, I'm just no good at this, and I'm everybody's looking at me, and I'm not going to do well. And those are the kind of thoughts that stop the nervous system from doing its normal job of synapsing. These are inhibitors to normal synapse. So when we have these negative thoughts, they stop us from being able to make good decisions. And we see this every day. The minute that we have a little bit of anxiety, that's what's going on. Anxiety is inhibiting execution. I'll say that again. Anxiety inhibits execution. I often tell people, I'd rather you execute and fail than to be stuck in anxiety and not try. I'd rather you try and fail, execute, than to be paralyzed by the anxiety. And to give yourself permission. Like a lot of times we grew up where the expectations for us were perfection or 80%, right? And the reality is life isn't like that. Think of how a child learns to walk, or how a child learns to draw with their fingers, or how they learn to talk. There is a whole lot of failure going on in the attempt to do it, but we keep executing, we keep trying, and we start every day with a new day. So I want you to think of like, how do I start that new day? How do I identify when I do have that negative rhetoric? How can I change it? Other things, spinning thoughts and self-deprecation, those are all things I'm talking about where you wouldn't want that in a friend. You wouldn't want a friend that talks to you like that. So why would you allow your brain to talk to you like that? It's not you talking to yourself. It literally is thoughts that we have allowed to be part of our circuit. And we can also disallow them as part of our circuit. We can change that dialogue. And it takes work. And it might require that you go see a counselor. That helps me going through training and learning how to put what's going to be in my RAS. Am I going to put the negative thoughts in my RAS, or am I going to put positive thoughts in my RAS? And if I can identify it, I can replace it. The last one I have here for us is this idea of being consistent. Being consistent with the behaviors that will bring joy back into your lives, right? How do we do that? And so I wrote down three things. One, I wrote down, make time for yourself and adhere to the new schedule. And this is something that always challenged me because I travel a lot. And I started realizing, like just recently, I'm staying at a hotel, Hampton Inn. Hampton Inn, do they have a gym? Yes, they have a gym. Do they have a Peloton bike? Hey, they have a Peloton bike. It's just like the bike in my house. So that means I'm going to ride the Peloton bike every day while I'm in LA at the Hampton Inn. Is there food compliant with my diet? Nope, it is not. So I'm going to go to Whole Foods and buy some food, even though they have free breakfast at Hampton Inn. The food they had there was not in my diet. It was not acceptable. And so I got my own snacks, my own food. I found my own restaurants, and I was able to make it so that I was consistent with what I would do at home or what I would do in Miami, where I also have a place that I've created that environment for myself, right? The second thing I have there is to have a close friend or spouse or partner that loves you. They have to love you, right? And that will support you in the positive and negative times. They're not going to judge, but they are a confidant that we tell, this is what I'm trying to do. I really want to stay away from these foods. I really want to try to do cardio 3 times a week. And this is the day that I've chosen to do that. And I just need to vocalize it. I need to tell somebody I trust and I know loves me. Can that person be you? If it's you, then I feel much better. And then just help me, like, wink at me every once in a while when you see me starting to stray away from that, to remind me of the commitment that I'm making to myself. I'm not making the commitment to them. They're just somebody that I trust and I love, and I know they love me. Make behavior decisions ahead of time before the challenge is probably the most important one. So like what I did this time in LA, it was like, I know the Hampton Inn, that's my hotel of choice. It's the bed that I like to sleep in. It beats Holiday Inn's bed any day. Just saying, I know that's their advertisement, but I like Hampton Inn better. I even went to the extent to buy a Hampton Inn orthopedic mattress that they have, and I love it at home. There's no paid commercial. I don't get incentivized, but if you're listening, Hampton Inn, you can send me a check in the mail. Make behavior decisions ahead of time. So we know when the temptations are going to happen. We know when we're going to be challenged with things. Make the decision ahead of time. I'm not going to have that, I'm not going to drink alcohol anymore, or I'm not going to smoke anymore. Make it before you get into the environment where the drinking and the smoking happen. I'm not going to eat sugar anymore. Make that decision ahead of time before you're sitting in front of that cheesecake, right? And what you start realizing is you get 3 weeks of that successful planning and making decisions. Pretty soon it's very easy to say no, because you've already made your decision. You're feeling better already. You've become stronger. All right. Before I jump into this last part of looking at how do we help our clients with their overcoming their setbacks and their challenges, I saw a whole bunch of nice things coming in on the chat, and I can't read all of them because they're a little small for me. But I hope that we're seeing some thoughts going through. I saw some ideas. I'll definitely read them later, and I'm going to put my notes into the post-production. I'm going to give them to Melissa so you can actually read my handout. I didn't want to make slides. I wanted to be able to talk to you about it and not let it be all about the slides. So let's jump into this last part. We've got about 5-6 minutes, and this is where understanding helping our clients overcome setback. And remember, setback can be physical, emotional, spiritual, mental, psychological, economical. There's lots of ways that we could experience setback. And sometimes it seems like it's just pouring down setbacks, right? And a lot of our clients are coming to us because they're in a setback. They're looking for a way to get out of the hole, the way to feel better about themselves. And I sort of put here like there's three things that I think we do very well, or two things that we do very well for our clients. Number one is we create hope. Remember how I was talking about that first slide, that some of us feel a little hopeless. Many of our clients feel hopeless because they're being told hopeless things. If somebody tells you, hey, you got leukemia, or hey, you got this back injury, it's never going to get better. You're always going to be this way. You have to wear a brace for the rest of your life. You can't ever bend over and touch your toes. And you have to make love laying on your back flat on a hard mattress, right? So all of a sudden you have these things, these ideas of like hopelessness. I never can be part of life that way I used to be. So what I find are a couple things that help us. One is positive movement experiences, right? We've talked about this a lot. Our job as movement practitioners is we can create positive movement experiences that exceed the expectation or without pain for our clients that start to reestablish the sense of hope. As Angela was able to start teaching me and having me create my own positive movement experiences of straightening my left leg in a very basic Feldenkrais approach, was one of the first big eye openers. It's like, you know what? I might actually not have to have knee surgery. I might actually be able to walk again. I might be able to go to the airport and not have this huge heart anxiety attack that feels like I can't breathe because I'm afraid that I can't get all the way to the terminal without having to get a wheelchair. And those are the exact thoughts going through my head the first day that Angela was getting me to work on a proper alignment and load into that left leg that was just starting to calm down from the epidurals. That was hope. It was a positive thing for me. The other thing that we talk a lot about in Polestar is language. Now, Shelley Power is probably one of the best at this, but looking at how do we have a language of empathy and compassion? How do we acknowledge what they're feeling? Things like, I believe you feel like that. I believe that you feel like there's knives sticking in your back. I believe that. I'm sorry to hear that. I know that must be very difficult to have that feeling, right? Acknowledging what they're saying as being something that's true. It's true to them. And I can see how this is a challenge for you. And then having the compassion is rather than saying, I'm going to solve your problems, it's saying, is there anything that I can do for you? Or is there a reason why you came to me? What would you like me to do? Right. And then one thing that we're very guilty of quite often when I go into studios and clinics is I hear people sensationalizing or catastrophizing. Oh my gosh, you got a 15-degree scoliosis. Oh my goodness, your left hip is anterior of your right hip, or your hamstrings are so freaking tight, right? So we create the sensationalization. We create that problem quite often in justifying our own position or our own role in the gym or in the studio space. So I'm begging you to stop the sensationalization, to be able to say, yes, I can see where having a stenosis could be a real challenge. But I also know that there are thousands of people that have stenosis that have never, ever felt back pain in their life. How can we get you to be one of them, right? How can we desensationalize the fear that they have, create then a positive movement experience without pain, create limits that don't allow them to keep pinching that nerve in that left lumbar foramina, and increase their thoracic mobility and hip mobility? Pretty soon they come back and they go, oh, my stenosis is gone. Well, their stenosis isn't gone. The disc hernia didn't disappear. It just, we quit aggravating it. And we created new strategies in our Pilates field that allow them to enjoy life and return to life without necessarily having to have surgery. And if they had surgery, we can create an environment that allows it so they don't need a second surgery or have a failed adjacent joint syndrome, right? The number two thing that I think is really important before we close is increasing awareness of self. I can't emphasize this enough. We need to back away from the cueing vomit with our clients. We don't need to give them all that information like we had to do when we tested out, right? Back away from it and use a little bit more internal feedback by asking them questions. What do you feel when your pelvis is in this position? What do you observe when your legs are in this place? How do you feel about that, right? And this is the way that we get them to start asking questions inside. What do you feel? How does breath feel there? Does it feel labored? Where do you feel your chest expanding? And let them start coming up with the answers to those questions. And that internal feedback, then we can start challenging the client's, abilities to feel things in a different way. I can guarantee you that what we think we're cueing is not what they're feeling inside. We can't make that assumption. I'll repeat that. What we're cueing, tactile, verbal cueing, is not what they're experiencing inside their body. The only way we know that is to ask them. And we have to be patient for them to try to put together what they're feeling and how are they going to articulate that to actually make sense? How are they going to do that, right? The last thing on here is challenge clients to shift their language when their language is reflecting an external locus of control or damaging thoughts. So when you hear certain languages, we can sort of call them on it in a very nice, compassionate way. And we start having them try to say things differently. I can't do that yet, right? Or I would do all these things, but let's get rid of the word but. Let's do an and. I can't do all these things yet. I want to do that, and I think I can do it if I can get my legs stronger, right? So it's starting to change their language from those things. This is something I've been working on, and feel free to share it if it makes sense to you. But I feel very strongly about this idea of how we impact the world well-being. And you know what Polestar's vision statement is. But I believe that when we have increased awareness of our bodies and our body-mind connection, we will make better decisions for ourselves and others. Our job as Pilates practitioners and healthcare practitioners is to facilitate the alignment and the awareness of others. And then we can trust the universe to do the rest. We don't have to be the doctor. We don't have to be the psychologist. We don't have to be the family counselor. But I believe wholeheartedly in the concept of awareness. And in every faith that I know, most of the faiths that I know or am interested in, whether it's the Akashic field, whether it's the universal energy and the cosmos, whether it's the Holy Ghost or Holy Spirit, we all have this belief that there is a higher sense of awareness and belonging. And when we're present and we connect to that space, we have unlimited access to innovation, unlimited access to love and kindness and acceptance and tolerance. Now, I'm not preaching that when I'm with my clients. What do I do with my clients? I help them find alignment and awareness. And I trust that God and the universe will help them find their personal alignment that brings them to a place that they can be a better person. They can be healthier. They could be a part of making a better community. So this is where, every day, this is my why, right? Some people ask me why I do what I do. This is my why. This is why I wake up in the morning. This is why I do the Pilates hour. And if you know me, I hope this is what you feel is my why. But it's bringing the world physical, emotional, and spiritual alignment. How I do that through movement. I believe that movement, well taught, with proper awareness and alignment, aligns people's mind, body, and spirit. And that is fundamental to the work of us as Pilates philosophers, Pilates teachers, Pilates certified practitioners, however we label ourselves. Fundamental to that is this alignment of body, mind, and spirit. So I hope that this lecture and discussion has helped you. Really excited about the content coming up in the pathokinesiology. We do have just a few more. I think we're over 100 people that have signed up for this foot and ankle workshop that we're going to be doing on Saturday for 3 hours. And if you cannot attend it, it is recorded, and you would get the recording of that if you registered for that course. So we'll send you out the list on that. I know that Melissa will also make that available to you, and you still have time up until tomorrow or even Saturday morning if you needed to and you felt like you could take those 3 hours or take another 3 hours. So I hope to bring some great light to the subject of foot and ankle that are so important in our work as Pilates and physical therapists. And I guess that's it. Wishing you all the best. And above all things, I hope you have a great weekend. I know the world is very chaotic, but the thing that I ask most is that we all go into the world and be kind. Thanks for joining me in Polestar, bringing the world physical, emotional, and spiritual alignment through movement. Have a nice weekend.